Hello and welcome back to my channel. My name is Claudine and feel free to be part of this channel, this growing channel. I'm very excited to talk about something that's very near and dear to my heart. A little bit about me. I am a wife, a mother of 2 girls, and I am a professional provider. Feel free to call me Dr. Onsongo. I'm a doctorally prepared nurse practitioner. I'm dual certified in acute care and psychiatry mental health. So today I'm going to talk about mental health. As we know, May is Mental Health Awareness Month, and this has been observed in the United States since 1949. And the main goal is to try and create awareness of mental health. So today I'm just going to do an overall view of what mental health statistics are, and the information I have were obtained from Forbes Health. And if you see me looking down, it's just because I'm trying to get the actual numbers. I didn't cram everything with me. So there are millions of us that are affected by mental health, either directly or indirectly. And mental health can be very debilitating, either to an individual, a community, and even on the financial status of a family, an individual, and even the entire community. So mental health, at a glance, there's different mental health diagnoses that are out there. And they can be classified into major groups or categories, ranging from mood disorders, eating disorders, developmental disorders, among others. So about the statistics, mental health statistics at a glance, 21% of US adults have at least one mental health disorder. And this is information from 2020. So with the COVID affecting very many people, I'm sure this number has gone up a bit. And to continue, 5.6% of adults experience serious mental illness. And when we talk about serious ones, the major ones that are really affecting people in terms of their daily living are things like schizophrenia, bipolar, depression, anxiety. These are major things within our community that we see either from individuals or even within a family setting. And in 2020, 32.1% of US adults experienced both a mental health condition and substance abuse. Substance abuse is broad as well. We talk about alcohol use, opiates, benzodiazepines, and all these can affect an individual or even a family. Let's take a situation where a father who is the head of the family uses drugs, and before you know it, there's strain in the relationship, there's strain in your financial status, there's strain in even maintaining an adequate job because you never stay sober or you're always under influence. So substance use disorders is very detrimental. Let me say it that way. And in 2019, 15.3% of US veterans experienced a mental health condition, such as post-traumatic stress disorder, depression, or substance abuse. So PTSD, which is post-traumatic stress disorder, is very common among the veterans, especially those who are in war zone areas. So these are some things that, if not well taken care of, can affect somebody's health, somebody's daily living activities. As we proceed, in 2020, suicide was the second leading cause of death for US children ages 10 to 14. That's huge, yeah. Another statistics here, in 2020, 51.2% of US females received mental health services, while only 37.4% of males received mental health services. And why the difference? Women tend to open up more compared to men. And it also ties with just the overall health services that men get. Men are a little reluctant in seeking any kind of treatment, whether medical or mental. That's why there's a difference in the statistics. So if you compare 51.2 of females versus 37.4 of male, that's a very big percentage. So we encourage all of us to get out there and seek mental health care. We understand there is stigmatization, and this is the main goal, to try and destigmatize mental health within our communities. Let us embrace it as individuals, as family members, as the community, and help the individual seek care without placing a label on their illnesses. Young adults ages 18 to 25 within the United States have the highest rates of mental health concerns, and that is equated to 30.6% compared to adults of 9.7%. So between the ages of 18 to 25, there's more mental health concerns. This is late high school to college students. There's more mental health concerns, but are they seeking help? That's the big question. As parents, as siblings, as instructors, let us be on the lookout for our students, our kids, and just see, is there any way we can help them deal with the mental health issues? And being able to handle these issues earlier in stages will prevent negative impact on their lives. At least with that, they can be able to continue their careers, continue their life, and even start a family without an impact on the mental health situation. Another statistics here, females are diagnosed with serious mental health illness conditions at a higher rate than males. 7% for females versus 4.4% for males. And I think this is based on the fact that females tend to open up and speak more openly about their mental health conditions. They tend to seek care compared to men. So that's why the statistics are off here. The females, of course, if more females seek care, the percentage is going to be higher compared to when males seek mental health care. So, how many people are living with mental health conditions? So here are more statistics that I have with me. Nationally in 2020, and as I say, this is probably higher because this was like the peak of COVID-19. And as we know, COVID-19 brought along more statistics with it concerning mental health disorders. There's more people diagnosed with depression, anxiety, post-traumatic stress disorder, especially those who worked directly with the COVID patients, like the nurses, the doctors, the CNAs, those who are working directly with them. Such people still have traumatic thoughts about the event. So there's higher statistics on this. So let's look at this that we have here. Nationally, in 2020, 21% of US adults, that's about 52.9 million, experienced mental health conditions. Worldwide, due to COVID-19 pandemic, the number of anxiety and depression grew tremendously. The number grew from 193 million worldwide to 246 million. Whew. That's about 28% increase in the rate. That's for depression. While for anxiety, 298 million people were affected previously, and the rate grew to 374 million. This is about 25% increase. And when we talk about the age groups, young adults 18 to 25 within the United States have experienced the highest number of mental health conditions. That's 30.6%, followed by those 26 to 49, which is about 25.3%, and adults ages 50 and over, 14.5%. And mental health affects people differently in terms of race and ethnicity. Multiracial had 35.8%, non-Hispanic white people had 22.6%, non-Hispanic American Indian or Alaska Native, 18.7%, Hispanic or Latino, 18.4%. So the common conditions, as I had mentioned earlier, anxiety, depression, PTSD, bipolar, schizophrenia, those are major mental health disorders that can affect people in different ways. So the symptoms of different conditions present differently in most people, but there are those clustered symptoms. This video is just for statistics purposes, and it's not meant to scare anybody, but at least to create awareness within our communities, within our families, within our places of work, and even just within our environments. So how can you seek help? The easiest way to seek care is through your primary care provider. Talk to them. They always have connections to guide you on how to seek care. Most primary care providers should be able to treat simple mental health disorders like depression, anxiety, insomnia, which is like lack of sleep. When it goes to anything beyond that, you need to see a psychiatrist. And this can be a medical doctor, osteopathic doctor, or even a mental health nurse practitioner. And to add on to that, physician assistants as well are trained to manage mental health disorders. So make sure you seek care, talk to your friends, talk to your family, seek care, and this will help bring your life to a better level. Don't be afraid. Don't look at yourself as a failure because of a mental health condition. This is a normal kind of living situation. The biggest step is to just seek help from a trained professional, and these people can help you walk through the next phase. And the other group of people that can help you with this is the therapists. There's different kind of therapy sessions that can be used for different mental health conditions. And talking to your psychiatrist can help you find a therapist, or even just finding one online or doing a Google search will help you find a therapist that's closer to you. Some of them do in person, some do virtually, whichever way that suits your daily lifestyle. That will work. And if it's something that they need you, I've seen situations where people just go through therapy, and this helps them cope without starting on to medication. So definitely there are those conditions that you will need medications for. Something like schizophrenia. You can't just do therapy without medications. You have to take some medications to keep your symptoms under control. Something like depression and anxiety, those can be managed just by therapy sessions. And of course, make sure you seek help from a trained professional for your treatment plan. This is for information only and is not meant to replace any care you get from your provider or even from your therapist. Thank you so much, and let's create awareness within our community, within our environment, within our places of work. And you know what? The main thing is, let us be a brother's keeper, a sister's keeper. Be blessed.